Here are 3 medications with the worst withdrawal symptoms. I'm Dr. A GP based in the UK, and when patients start these medications, it needs to be made clear that it can be very hard to come off them. So the first medication is called paroxetine. This is an SSRI medication, and it's probably the worst SSRI medication for withdrawal symptoms. Withdrawal symptoms can include headache, nausea, fatigue, muscle cramps, flu-like symptoms, and insomnia. These symptoms can be so bad that sometimes patients need to change to fluoxetine, which has a longer half-life, to try and wean off the medication. So number 2 is the second most prescribed medication here in the UK, and it's omeprazole. Omeprazole works by basically reducing the amount of acid your stomach produces. And when you try to come off the omeprazole, your body reacts by producing more acid, and this can give you initial worsening symptoms of heartburn and reflux. So patients need to expect this so they can kind of get through it for the first 2 or 3 days. But often patients aren't told this, and they go back on the PPI or omeprazole, and this is how they get stuck on it for many months or even years. And finally, number 3 is zopiclone. This is a medication used to treat insomnia. It should never be used long term and should only be used for 2 or 3 days max, because when people are on it long term, it can make falling asleep without it even harder. Therefore, they require zopiclone or other medication to try and fall asleep.